I want to give a special thank you to Margie O'Brien and Capitol TV. Margie's not here today. We're going to go back to the more traditional way of reporters asking their questions. Margie didn't get a single day off. She got off Easter and Mother's Day. So thank you, Margie, for chipping in and being so fantastic for the past 8 weeks. So as you can see from the data reported on the screen, it's a good news story with this data. It's a continued plateau and a continued, actually, decline in new hospitalizations. We have 176 new cases, and very, very sadly and unfortunately, another 8 deaths. As I've said before, reopening the economy doesn't mean the virus is going to go away. The virus is here to stay for probably about a year until we have a vaccine or a very reliable therapy. However, we've learned how to deal with it. And as you can see here, everybody wearing face coverings, social distancing, hand washing, staying at home if you're sick. These are all the things that are going to keep us safe while we go ahead and start to reemerge, leave our homes, and go back to work. I will say that I lifted the stay-at-home order on Saturday, and I'm very pleased to report that, only 2 days into it, things are so far going very smoothly. Mother Nature probably helped us out over the weekend. It wasn't the warmest weekend, so we did not see everybody rushing out. We didn't see a lot of large group gatherings outside, even though the parks have been reopened. We had many inspectors out visiting hundreds of local businesses, and we noticed 95% of employees were wearing face coverings, so that was terrific. Thank you to all the retailers and employees. Unfortunately, customers were closer to about 75%. So we do need to do better than that. If you want to go out shopping, and I hope you do, because our local retailers need a hand, they need the business, you do have to wear your face mask. We have to do better. 75% isn't where we want to be. I want to remind everybody, our focus here is voluntary compliance. It's very easy to wear a face mask. Just wear a scarf. Any cloth covering that covers your nose and your mouth is very important. We also continue to see very mediocre compliance of people with their masks on at drive-thrus. If you go through a drive-thru, pick up your food, pick up your coffee, you are within 6 feet of the cashier at the drive-thru, so please, even though you're alone in your car, for that moment in time that you're paying or getting your food at a drive-thru, I'd ask you that you please put on a face mask or a cloth covering, frankly, out of kindness and courtesy for the hardworking person at the drive-thru. Okay, so I want to take a few minutes to talk about reopening. I want to begin again by thanking the people of Rhode Island, thanking businesses, thanking everybody for their cooperation. 7 weeks ago, when we were looking at our models of where we were and where we were going, if we stayed on the trajectory we were on at that point in time, we were looking at 8,000 or 9,000 hospitalizations and more than 4,000 deaths. The picture today is very, very different than that, thank God. Much, much, much lower experience of fatalities, sickness, and hospitalizations. And that's because Rhode Island stepped into action, obeyed the stay-at-home order, closed down businesses as hard as that was. And now Rhode Island's in a better place. Furthermore, you've given us the time we've needed to get our systems ready to handle increased cases should that happen when we start to reopen the economy. And, contact tracing, testing, hospitals, extra staff, PPE, ventilators, and the like. So because we've really flattened the curve, because we've built up our system and have the infrastructure in place to take care of folks, now we're in a very good position where we can start to slowly reopen our economy, slowly start to go, back to work, back to shopping, and feel confident about that. And I do think that's important. I want you to feel confident that when we open retailers, as long as you're following the new rules, it's okay for you to get out there and go do your shopping. It's very important, though, that we go slow and we be cautious. Slowness and cautiousness. And particularly for older folks or folks with underlying health conditions, you have to be especially cautious. Now we know so much more about this disease than we did 2 months ago, and the thing that is certain is that this disease is toughest on the oldest among us, the most frail among us, and the sickest among us. So if you're in those categories, you have to be extra vigilant to take care of yourself and follow the rules. I would say also, tension is running high. Lots of people have been out of work for a long time. Restaurants and shops have been closed. We've all been cooped up in our house for weeks. Our kids, I see it in my own kids, they miss their friends, they miss the routine of school. So the inclination can be to get frustrated, lose patience, get angry. You see a protest, just today, people are frustrated. So I'm going to ask you again to be kind, to be patient, to keep yourselves informed, and focus on facts and not frenzy. I only want to reopen this economy once. I don't want this to be fits and starts. Reopen, see a spike, close. Let's not do that. Let's go slowly, walk before we run, take this in phases so that we can never take a step back. And later this week, I'll be giving detail on how we think about moving from phase 1 to phase 2, and also how we think about when we might have to go back a step, which I hope doesn't happen. So what I would say to you is be cautious, go slow, be kind, be patient, and continue to look on friends, family, and neighbors. People are under an enormous amount of stress. If you can do anything to be kind, to be patient, to look in on a loved one, to bring somebody food, to take care of the elderly, please, I'm going to ask you to keep doing that. And also realize everything's going to be different. This is different. This press conference is different. When you start to go out for dinner, it's going to be different. When you go back into your office, it's going to be different. And my best advice on that is don't try to fight this. This virus is here. It is powerful. We don't have a cure. We don't have a vaccine. So don't fight it. Be creative, flexible, collaborative, and let's look to adapt. Adapt our way of doing things so that we can live safely with the virus. But we can't try to outrun it because we know that won't work. So I want to take a second to talk about restaurants. We have many, many restaurants. Many are just closed. They haven't been able to figure out a way to make it work with takeout and delivery. Those are doing takeout and delivery. They're operating at a fraction of the business that they used to do. And so it's a top priority of mine to do all that we can to help this industry. Like everything else, it won't be a flick of the switch. Having said that, I'm very pleased to say that we worked throughout the weekend to figure out a way so that we can allow restaurants to reopen outdoor dining only 1 week from today, May 18th. So over this past weekend, we had our first 2 days of retail openings under a new set of guidelines, and that went very well by all accounts. We don't know exactly how many shops opened, but we know there were many, many that opened, and we know that people were going out, and we know there were no major problems. So that gives me confidence to do a little bit more. So as of May 18th, restaurants will be able to begin limited outdoor dining in addition to takeout, delivery, and drive-through operations that they already currently have. Now, tonight, by this evening, there will be details on what the new guidelines will be for outdoor dining at our website, reopeningri.com. But I want to give you a flavor of what the new guidelines will be. I want to do that mostly for the public. Restaurant owners, go to reopeningri.com tonight. You can get all the details. Also, I want to give a huge shout out to Commerce Secretary Stephen Pryor, who's been in touch with literally hundreds of individual restaurants, plus the Hospitality Association, to seek their feedback. And you can go online tonight to get the details. But for the individual Rhode Islander who might be saying, oh, I'd like to go out for dinner next Monday night, what's it going to look like? Here's what it's going to look like. Dining will be by reservation only, so at least initially you won't be able to just show up spontaneously. Your dining party cannot exceed 5 people, and that's in accordance with the existing social gathering of 5 rule. Tables in the restaurant will be spaced at least 8 feet apart, or if not, will be separated by barriers. And there'll be no more than 20 tables in total in any particular outdoor space. Menus will be different. It's not going to be the traditional menu that you use and then the next table can use. We are recommending one-time use paper menus or digital menus or a chalkboard menu, or no menu at all. Maybe just your server will tell you what's on the menu. Condiments and utensils will either have to be single use or sanitized between uses. All high traffic areas will have to be frequently cleaned. Tables and chairs will be sanitized in between parties. Self-services food stations like salad bars, buffets, bar-type settings for eating will all be prohibited. Cashless and contactless payment methods will be encouraged. Pens and payment stations will be frequently cleaned. And for the moment, no valet services will be allowed. So customers will be asked to park their own cars. In addition, and I cannot emphasize this enough, please do not go dining if you feel sick. Actually, you shouldn't be leaving your house at this point in time if you feel sick. If you have a fever, aches and pains, a cough, a sore throat, the sniffles, you should not be going to a restaurant. Don't make the reservation. You shouldn't be going to work. You really should be staying home. This is important because it's different. All businesses, including restaurants and retailers, will have to screen customers for symptoms before they come into the restaurant, asking you, do you have any symptoms? Now, we are not requiring a particular kind of on-site screening. We're not saying it has to be a particular kind. It could include hanging a poster, asking customers to self-screen. It could include the hostess asking you. It could include a temperature check. That's up to the restaurant, but we don't want anyone who feels sick to be in a restaurant. When you make a reservation at a restaurant, you'll be reminded that you will have to be screened for symptoms when you go to the restaurant. And customers making the reservation will also have to provide their contact information for potential contact tracing purposes. In the event that somebody, why is this? Because in the event that somebody tests positive after being at a particular restaurant, the Department of Health will be able to obtain a list of those who have had a reservation there and could have come in contact with that affected person. So this is going to be one more tool to do effective contact tracing. So when you call, again, this is different. You can go out for dinner starting May 18th, outdoors. You have to call for reservation. You have to give your name and contact information. You will be reminded that you can't go if you're sick, and then when you show up for dinner, they'll ask you, are you feeling sick? And all of that will be tonight on a website. Furthermore, we're working with municipalities to create a streamlined process for the approval of outdoor dining and liquor sales. We have heard from a lot of restaurateurs, essentially, you know, they are asking not to have to go through a lot of red tape in order to enable the outdoor dining. It's a very fair ask. Department of Business Regulation has already been working with the League of Cities and Towns, municipal leaders, and mayors. We are coming up with new ways for it to be very fast and streamlined, so you can have whatever necessary permits and approvals you need in order to enable outdoor dining in different and new creative ways and liquor sales. And so by the way, DBR has been doing a terrific job through all of this, and they have some really creative ideas about how we can quickly enable restaurants to get up and running with outdoor dining. So it's my hope that in the next few days I'll have more to say about assisting small businesses, including retailers and restaurants as they reopen. We're hearing from a lot of restaurants asking, how will we help potentially with cleaning supplies and PPE and instructions? So we're working really hard to make it so that perhaps we could provide, say, one-time access to free and reasonably priced supplies to help out our restaurants as they begin the process of reopening. I don't have a specific announcement on that today, but it's my hope and intention that to give a hand to restaurants who are going to have more cleaning supplies and such, we're going to be able to help you out. So stay tuned on that. Finally, and related to that last comment, I'm hearing a lot from small businesses, restaurants, retailers, hospitality, really a lot of the small businesses that have been most affected by this crisis are asking, will we be able to provide some emergency relief? And they've noted that in other states, other governors have done this through the use of the COVID Emergency Relief Fund. And the answer is yes, and we're working very hard and as fast as we can on that. Again, I hope to be out within a week or so with some specific information about how we can help you. I realize that you are struggling. I realize that reopening is coming with additional expenses. Could be plexiglass, could be signage, could be new menus, could be cleaning supplies. And so we definitely intend to use some of the COVID relief stimulus money to give a hand to our small businesses. And I'd ask you for just a little bit more time to put the details out around that. Additionally, as of later today, there's going to be a place on the reopeningri.com website to ask you for your feedback on how we could most effectively use stimulus funds to help your small businesses in the here and now. There's a lot of examples out there from other states that we're looking at. I was on a call earlier today with the White House and other governors, got some good ideas. Stefan's been working hard, but I want to hear from you too. If you're out there and you're struggling, if you're self-employed, if you're a small business, the best way we can help you is if you tell us exactly what your needs are. So later today, reopeningri.com, there'll be a place for you to send us your specific feedback on how we can best use the stimulus monies to help you, and I hope you take a minute to give us your ideas.